Cervical cancer is the only cancer that we can actually confidently say can be eliminated. It's the only cancer that we know what actually causes it. It is the human papillomavirus. But what does elimination really mean? Marion, do you want to shed more light on that?
Yeah, so elimination of cervical cancer is possible because we understand the biology and we understand how to leverage that to prevent the development of cancer or detect it early when it's very treatable. Because it's a disease that can be almost entirely prevented through vaccination and screening, it is a disease of inequity, and those inequities exist within countries, even in countries like Australia, and between countries, and have to do with access to the tools and access that is culturally safe, inclusive, and accessible to various communities. So the target for cervical cancer elimination is an achievement of an incidence of 4 per 100,000 that's been globally agreed.
So 90% of the girls to be vaccinated, 70% of them need to have access to two lifetime cervical screens. We'll talk about that in a short while. And 90% treatment to detect the lesion. So vaccinate, screen, and then we hope to treat. We need to, fulfill that.
Yes, I think what I'd like to distill and what elimination means, sometimes the number doesn't mean anything to the people who are trying to achieve this. What does a public health problem of, 4 in 100,000 women mean? But let me put some context into it within the community. So if you have a cancer that predominantly affects women in the lower middle income setting, that is such a big issue. You're in countries you're seeing incidents of 13 or even 20 per 100,000. And when this woman has got cervical cancer, it means not just her, but her entire family, her entire community is affected. We now have the opportunity, if not the responsibility, to say that we have the tools to ensure that such a person within a family and community does not need to have cervical cancer anymore. And that's what we're trying to achieve globally to bring this protection to families. And yes, that's the end-to-end care in terms that we need to try get girls vaccinated, women screened with now a very simple screening method which we'll talk about, and also to ensure that if we screen them and we find an abnormality, they have access or they're guided to treatment, which is often life-saving and preventative if we do it at an early stage.
So yes, Australia has been very successful with preventing cervical cancer, and we now have an incidence rate that's just above 6 per 100,000. And we very much...
6 per 100,000, you're almost there.
We are.
So Australia is probably going to be the first country to eliminate cervical cancer.
We hope Australia will be first to eliminate. But I have to share with you that the gains aren't equally shared around the country. And so for us, we want to reach 4 per 100,000. We'd like to get there first in the world. But we also need to address inequities in our own community. So we have enjoyed access to vaccination and screening programs for a very long time, and the screening programs have been organised and supported by government for many decades and with bilateral support, meaning we're not reliant on a particular government being in office for the program to continue. And I now realise that's a very great privilege. However, our Aboriginal and Torres Strait Islander population experience cervical cancer at twice the rate of non-Indigenous Australian women, and they're dying at more than 3 times the rate. So we've got some work to do within our country. But having said that, we've also learnt some technical lessons about vaccination screening, and my colleagues in the cancer treatment and pre-cancer treatment space are also very experienced, and we think we've got a role to play and indeed a responsibility to share our technical experience with countries in the region. So we're very, very lucky to have attracted some generous funding from the Minderoo Foundation in Australia, and that's been catalysed some other funding and a generous donation of test cartridges, so laboratory consumables from Cepheid. And we are doing an implementation project with partners from the Daffodil Centre, from the Kirby Institute and Family Planning Australia. And our consortium as a whole have relationships in Vanuatu and the Western Highlands province of Papua New Guinea. And the goal of this exercise is actually to show that the 90, 70, 90 targets can be reached in these communities, to demonstrate that to the world and to put those, the Western Highlands province and Vanuatu, on the pathway to elimination by achieving the targets. These are very challenging environments, and there are some very talented people within Papua New Guinea and Vanuatu who we're partnering with. And of course, while we bring some technical expertise, we also learn from our partners in those countries about what will work in their setting, and how to undertake particularly the screening piece of it. We're not experts in their communities.